Brilliant. Tonight, it is my pleasure to introduce Professor Kristen Quimby, who will be talking to us about presenting a zombie apocalypse. Anyway, but before we get to the show, I'd like to remind our audience at home and here at Lang Lab that Pop-Up University is brought to you by the folks at the IU South Bend Center for Community Engagement, as well as the Center for Excellence in Research and Scholarship. If you're interested in having IU South Bend expertise assist your community group, business, organization, or any community endeavor, please get a hold of Professor Gail McGuire, Director of Community Engagement, or me, Senator Josh Wells, Director of Series. We would like to thank our sponsors tonight, especially Indiana Humanities, as well as the IU South Bend departments and offices in many College of Arts and Sciences disciplines, and the College of Arts and Sciences itself. And I'd like to remind everyone at home, please just feel free to Google IUSB pop-up to find YouTube videos of previous events and the YouTube video of this one when we have it up in a day or two. You can also watch for upcoming live streams, and if you're inclined, donate to support, please. So tonight, it's my pleasure to introduce Professor Kristen Quimby, discussing how to prevent a zombie apocalypse. Professor Quimby is one of our most popular young faculty. She's been a couple of years ago, she was named Educator of the Year from Student Life. She's also won the Carol D. Mincio Leadership Award. She works in a variety of public health, and dental health activities, domestically and internationally. Some of our most popular courses are when she leads health promotion and disease prevention trips to Costa Rica and Belize. She's just simply a fabulous speaker, and as you can tell from our very popular topic tonight, she knows how to show everyone a deadly good time. All right, and with that, I give you Professor Kristen Quimby.
Thank you very much. Thanks, Josh. It's going to be a little different for me to be not walking around any of my students that happen to be online. Hopefully there's a few of you know how much I talk with my hands and actually move around. So I'm going to keep an eye on Joel if I get off camera or am flailing too much. So keep me on track with that. And my phone is up here. I'm not texting. I'm not doing anything. I'm timing myself. As you know, faculty, we can be long-winded as academics as well. So without further ado, why in the world am I talking about preventing a zombie apocalypse, right? I don't know if any of you have seen this or read this on social media a few years ago. This was circulating pretty widely. People saying, oh, Nostradamus, he actually predicted the disease that we're not going to talk about tonight. And of course, the reference that I have here was a fact check on that. And of course, he actually wasn't predicting a zombie apocalypse or COVID-19. But one of the things that was circulating around this time as well is the Centers for Disease Control and Prevention, wildly successful, albeit it started as a tongue-in-cheek campaign on disaster preparedness. And they used this very creepy image of a zombie. And it's one of those health promotion types of campaigns that people just jumped on board with. And it really brought the understanding and respect for public health into the limelight, right? And so what we're doing today is to talk about public health, okay? I'll situate it a little bit as well with my background. I'm actually a dental hygienist, a registered dental hygienist and an alum actually of IU South Bend, 3-time alum of IU South Bend. Yes, yes. I loved it so much that I wanted to come back and teach. And I've been teaching with IU South Bend for 18 years. I actually went on to get my doctorate in health education, so a public health focused field where we did epidemiology. I did applied research in public health. and then got my certified health education specialist examination. So that kind of situates, why I'm talking about public health, where this is coming from. And in part of my continuing education requirements for my dental hygiene license and my certified health education specialist credential, I actually took a course where a university in the nation was partnering with local school systems. And they wanted all of the different units across their campus to be involved in this. Of course, great recruitment, retention, enrollment, all of that. So the School of Public Health, they got together and they're like, what are we going to do? How do we keep kids engaged in things like biostatistics or disease surveillance and all of that? And one of them went, hey, have you guys seen the zombie campaign? And so they built their entire outreach with the kids coming to campus around disaster preparedness and using the zombie. And of course, The Walking Dead happened to be really popular then. I've never seen an episode of that, so don't shoot me on that one. But it was very, very well received, and the faculty had a lot of fun. So something that we'll have to think about as a campus, right? I taught actually a master's class this past fall on the same topic. My students were actually kind of disappointed day one when I said we actually weren't talking about zombies, but nonetheless, they remained engaged throughout the entire semester. So I'm putting this out here right off the bat for those of you online, and thank you for joining in your pajamas or in your backyard, having a glass of wine, whatever it is outside. We probably could all be with you as well. And thank you to you guys for coming out tonight as well. But I have to put it out there. I am not an expert in COVID. I do not play an expert on TV related to COVID. We are not talking about COVID tonight. We may possibly, there we go. We may end up talking a little bit about Bruno. I'm hoping everybody knows, maybe online. We're not supposed to talk about Bruno. If you haven't seen the movie Encanto, please see it. And for those of you who know who Bruno is, you're welcome for having the song now stuck in your head for the duration of my talk. That's been my pain. I have no idea why I chose to put this image in here. Every time I've looked at my slides, song in my head. My daughter thinks it's hysterical, but all right. So like a true professor, I have to start with the end in mind. When Gail approached me about speaking at the pop-up, I thought, ugh, what do I do? I wanted to do it, but I wasn't sure where I would want to go without fire hosing people with information. There's tons of public health related statistics and data out there. You can find it. You can Google right now and say how many people in Indiana are dying from cardiovascular illness. It's out there. It's right at your fingertips. And so as I thought about it and really thought about my roots, dental hygiene is rooted, no pun intended, in public health, right? And my health education doctorate is also rooted in public health. It serves as the foundation of really all of our health professions in the College of Health Sciences. It's the thing that ties us together. But a lot of people may not understand the big picture of public health. And so when I thought about what I could bring to the table to a general audience, it was how do I convey the message of understanding the influences on our health as individuals and then collectively as a community, right? And then I want people, and this includes you guys on Zoom, you will have to participate at some point, please, through the chat. I'll tell you, I'll give you prompts when that's gonna happen. But I want everybody to think about how you, sitting at home or here, how do you fit with public health? No matter your profession, no matter your discipline, not if you don't have to have a doctorate in public health, a bachelor's in public health, or a master's in public health. How do you as an individual and collectively as a society fit with public health? And then hopefully by the end of this, you'll be able to give me 2 examples of how you can actually affect change within your own community using what we use in public health, one of the many models that we use in public health called the social ecological model. So that's kind of centering what we're actually going to talk about. Again, I don't want to fire hose you with information. We're actually, though, going to start with a question. Okay, so hence audience participation, right? And it's really important, I pose this to my students, my undergraduate students a lot. We have to have the same foundation, right? We have to actually be defining and using the same words, meaning the same things, okay? So first and foremost, how do you define health? Think about that for a second. What is the definition of health? And folks on Zoom, feel free to put it in chat. Josh promised he's going to yell at me throughout the presentation, which is totally fine. How do you define health? Well-being. Yeah. Not being sick. Yes. She stole your answer. Anybody on Zoom? Thoughts? How do you define health? How do you know if I say I'm healthy or I say that I'm unhealthy? What is that metric? What does that look like?
A gazillion messages coming in. Yeah, let's see. Courtney says social emotional well-being and not just the absence of illness. April says health equals comfort and joy. Nicole says state of being free from illness. Lots of people agree with Courtney. Let's see. Making choices that positively impact well-being, says John. Balance aspects of physical, emotional, spiritual, psychological, and emotional well-being.
These folks are stealing my thunder right now. That is what's happening.
There's about 24 too. We may not be able to get
Right. All right. So the actual definition that was defined actually through the World Health Organization way back in 1946. It was recognized then that it isn't just the absence of disease, right? Disease being the biological derangement of normal functions when our body's homeostasis gets knocked off balance, right? That's disease. The World Health Organization ratified the Constitution in 1948, or implemented, I should say, in 1948. And this is still the working definition. And I want to note a couple things in here. It is a complete state of health, right? Physical, which we tend to think of, I don't have to go to the doctor, I must be well, I must be healthy. But we also include mental health. I think Courtney, I planted in the audience. I think she might be one of my students. But it also includes social well-being. And we know with the disease that will be unnamed through the duration of the lecture, we've been cut off from each other. Being humans, we are social creatures. And our social well-being and our connectedness to one another affects mental health, and it affects our physical health. And so that's why the World Health Organization established this definition for health that we still use today. They've added to it in amendments, just like any constitution over time, right? They've added to it to recognize equity and disparities and racism, all, right? So with that in mind, the next question, what is public health? So we have a foundation of understanding what public health or health is. What is public health? Yes, you have to answer. The health of the community. Anything online?
Courtney says population health.
Good.
The health of the population as a whole, says.
Good. Population of the health as a whole. So collectively, right?
Everyone's health as a whole, basically.
I love it. The basically, that's the qualifier.
That's mine. Thanks to Riley for that. Community well-being. Jenny writes, health for all, equity, equality, access. Sydney writes, collectively, everyone's general health. From Serena, the well-being of many communities. Cynthia, equality and opportunities.
Love it.
Aiden, the physical and emotional health of the individuals who make up a social group.
I love it. These are all audience plants, I think, in Zoom. So with public health, we're actually going to go back to 1920. One of the theoretical founders of public health as a discipline, Winslow here, CEA Winslow. The science and art of preventing disease, of course, right? The biologic derangement. And of course, anybody know what the map is? Outbreak of cholera. Yes, yes. So John Snow, essentially the founding father of understanding public health and how human disease spreads. Broad Street Pump is actually in the middle there in the blue. Still exists if you're a history nerd and you want to go check it out, or you're a public health nerd and you want to go look at it. But CEA Winslow in 1920 recognized the art, the science and art coming together to be able to prevent disease, prolong life, right? Promote health. And yes, there's a ... We're going to revisit this at the end. So we think we have a pretty good understanding of public health. Now we're going to quiz you. I won't give you the answers until the end. What I'm going to do is show you images and you're going to say yes or no. You can raise your hand. In Zoom, if you're feeling extremely celebratory, you can do the little whatever, the confetti thing. If you want to do a heart, you want to do whatever. You've got emojis that you can do to raise your hand and see if you think the images are public health. We're going to start out easy, so not a ton of pressure. Okay, vaccines. Okay, so raise your hand if it's public health. Good. It's actually one of the top 10 greatest public health achievements. That is one of the listed top 10 greatest public health achievements. I also have to plug fluoride. Water fluoridation is in there. Yes, one of the top 10 greatest public health achievements. Good. All right, next, water. Okay. Chat, everybody, Joel's back there. Yes, good.
Everyone likes water.
Great London smog blocked out the sun midday. Yeah, that is not a recent photo. You can tell by the police officer's mask. Luckily, times have changed. Although I don't know that the KN95s are any better. Okay. So situate yourself on this one. Okay, we're looking at water in a tire. Is that public health? Yes or no? Good. Okay. Ooh, good. There's something to be learned here. Bike lanes, public health. We have avid bicyclists in here too. So.
Lots of cyclists coming in the chat room.
Good. Okay. Crops. Drought? Mm-hmm. Yes or no? Okay. Wildfires. I'm loving the two hands of Joel in the back. Any clue what this one is? I know it's pixelated for those of us here. Aluminum recycling.
A lot of yeses online.
Our room is stumped on this one. You say, Andrew says yes. All right, Josh is saying yes. So we have a couple. Okay. They are all public health. Every single one of them. Aluminum recycling, unfortunately, whoops, I can't back up. Did you click on something? I don't know where the computer is being held. There we go, got it. Aluminum recycling. A lot of our communities of color live in areas where you have pollution. And that can be noise pollution. You can imagine how loud that has to be as they're grinding up the aluminum cans. Okay, so environmental racism at work here. Our wildfires, of course, particulate matter being increased. When we see wildfires happening, we see a rise in emergency rooms with asthma and other breathing related issues. And of course, you can't breathe, your heart's working harder. We have cardiovascular related conditions that happen and that are on the rise as well. Water, I don't know about you guys, but I trust every time I turn on my tap, I can fill my kettle up for my French press coffee in the morning and it's safe for me to drink. But that's not true everywhere in our country. It's not true in our own community. It's definitely not true in Benton Harbor or Flint, Michigan. They're still dealing with lead pipes. We're still dealing with lead pipes. Of course, we talked about the vaccines. I heard mosquitoes, right? With the tire, the water in the tire. What we're seeing is some areas are experiencing longer rainy seasons. Ticks are not dying off like they had been. Mosquitoes are not dying off like they had been. You can look right now, Google Lyme disease and the spread of vector-borne illness. We're seeing Lyme disease on the rise. And it's because we have these warmer months starting sooner. So the climate being warmer sooner in the year and staying warmer later. And again, I know that's not all across the board. Not all areas and regions are experiencing that. And of course, the crops, right? The drought. If we can't eat, we can't be healthy, right? Food access and supply chain. We're experiencing that right now, right? With supply chain problems, wheat distribution, all of that. That all relates to public health, okay? And so this begs the question, are you a lumper or are you a splitter? I tend to be a lumper, meaning that I don't believe that you have to have a bachelor's in public health or a master's in public health or a doctorate in public health to be public health. When I teach my students to do needs assessments in their community, they have to go in and find the data. They have to go in and look and see how many infants are dying early. They have to see the prevalence of cardiovascular illness in our community. How many people are dying from lung cancer or being diagnosed with skin cancer? They have to have those data to be able to do what they do in public health. Where do they get those data? They get them from our doctors, they get them from our nurses, they get them from our dentists and our dental hygienists, they get them from our clinical laboratory scientists who are actually in the lab looking at the blood work, looking for lead and checking all those things. They get them from all of the health community, right? But that's not where it stops, because I just mentioned water, right? They get them from our local health department. They get the data from everywhere. Who processes those data? Gail and I both teach statistics, but I don't want to do complex computations of millions of data points coming in. I need to rely on the statisticians. I need to rely on the epidemiologists who are in the field actually collecting the data from the people. So we need all of those folks. When I think about climate change and I think about, trees and pollen, anybody have allergies? It's starting earlier, right? The pollen is increasing. I need to touch base with the biologists. I need to touch base with our science community to figure out how we can partner to address some of those concerns. So we need everybody in public health. Hence why I am a lumper and not a splitter. Okay. What's that? Yes, lumper. And you'll find people in the profession of public health that very much splitter, only epidemiologists and only biostatisticians. That is the defining characteristic of a public health provider or practitioner. But I believe we can't do, really any one of our fields, we can't do what we do without everybody else. I think of my research area being in behavior theory. I rely on psychology to understand how human behavior works. Who better to know the community and communicate and work with society at large than my sociology faculty and friends? We need it all, right? And so when we talk about influences on our health, there's all these different things. How many of you have heard of social determinants? I'm hoping everybody has by now. I'm hoping I haven't been so entrenched in the field that I just think it's, complete. I'm hoping it's not complete jargon at this point. When we look at the influences on our health and we think back to the definition of health and the definition of public health, there are so many things in our lives that influence us, hence why attire was part of the public health picture, why bike lanes are part of the public health picture. Education, access, and quality is a piece of that puzzle that influences our health outcomes throughout life. Looking at healthcare, we have tons of healthcare agencies in our community, but we still experience disparities in health outcomes. Okay. So let's take a look at some of these. How does access to education and a quality education affect our health? And no, I don't have zombies in the entire presentation. I gave you a break with a kind of a cute zombie child. So how does access to education and quality education play a role in our health? Health literacy, I love it. Love it. Yes? Mm, right. So education on health related behaviors. So having nutrition education in the schools or physical education, things like that. Yeah. Sex education. Yeah. Whether it's allowed or not allowed, right? And inclusive sex education is the other thing, right? Yeah. So absolutely great examples of how education and quality education come together. The other side of that, do we have any from chat?
Learning health behaviors, creating awareness of topics, and education that can lead to education can lead to better economic status, better health.
Yes.
And understanding of medicine, creating increasing trust.
That's a great one. Increasing trust. Yes, absolutely. Laying that foundation early for children, being able to have health providers, thinking back to that public health school, having kids come to them or going into the schools and saying, I am a nurse or a dental hygienist or a health educator, and I'm not scary, right? I'm a person. I personally, just an anecdotal story, I know so many people who are afraid of going to the dentist, right? I never had that fear. My father was my dentist. I didn't have to worry about it. you know, so I just never understood it. But anyways, getting out there and exposing kids, absolutely. The research that's being done and has been done is linking early childhood education. So having the children exposed in pre-K, that actually translates to better health outcomes as adults. And of course, better health outcomes, better jobs, more economic stability, right? And that's not just an individual thing, that impacts society at large, right? We have a healthier workforce, we have a more productive economy. So early childhood education, linking it through. And if we think about it, when we have children in the classroom, they're being given the tools and resources from all facets, not just the health side of things, not just being taught about nutrition or physical activity and all of those things, but reading, writing, mathematics, science, all of those things, that stimulation of their brain. We're giving them the tools and resources to carry them throughout life to be able to have better health outcomes later and be positive, productive, happy, healthy members of society. That's public health, right? When children are coming to school, not knowing where their next meal is coming from, they can't pay attention. If they're coming too tired, they can't pay attention. So investing early in education and quality education, making sure that we have those social supports is really important for the future of our kids as it comes to health. Get into later in life, damage has been done a lot of times, right? It's harder to make behavior change at that point. Healthcare and quality. So when we think about healthcare and quality, that's one of the 5 social determinants of health. When we talk about health, we think of, well, I'm not sick. But healthcare is only, again, one of those 5 social determinants. We have a ton of healthcare facilities around here. Sharon, you probably know how many hospitals do we have, just, thinking about where our nursing students go, right? And our radiography students out in those rotations, right? We have a ton of healthcare agencies, but yet we still have a shortage of health professionals, health providers. We're still designated as a health profession shortage area for mental health and dental health in our community. We don't have enough. And nurses, you guys are in crisis mode across the nation. We need more healthcare providers. So it's only one piece of the puzzle to have healthcare and have access. That's the other part of it, right? Access to healthcare. Even if we have the facilities, it's not the if you build it, they will come. That's not how this works in healthcare. We still have barriers. We have language barriers. We have cultural barriers. We have inequity. We have implicit bias and racism still existing in healthcare. I can tell you, and Sharon can tell you, we educate our students about all of that. We teach our students in the Dwyer College of Health Sciences about disparities, about racial inequity and justice, and why all of those things matter. It's not just about the clinical provision and being out in the community and treating patients. It's the whole person. So that child coming in hungry to learn, they can't learn, right? If mom is worried about how to put the food on the table, or dad is worried about how to, excuse me, put the food on the table, they're living in a constant state of stress. I don't know about you guys, but I've experienced high times of stress in my life, and it throws everything off. I can't sleep. I can't eat. I get shaky. I get nervous. I get anxious. Imagine long periods. We're doing a lot of research now in public health on toxic stress and the fact that it changes your chemistry. Your blood chemistry changes. All of the cells that, or the chemicals in your body that release the fight or flight, those are supposed to be in short doses, right? It's get away from the tiger. But once the tiger is gone, all of those things should shut back down. But when we're living in toxic, stressful environments, those never get turned off. And unfortunately, what happens is the body starts to attack itself. Lots of interesting research out there. So healthcare is not the only thing. We have to stop what's causing the toxic stress in the first place. If it's food, if it's transportation, if it's income, hence bike lanes and why they're public health, and school systems and why they're public health. So if you needed a visual graphic on how that works, you can see the healthcare system is just one piece of that pie, but look at the rest of that graphic. That's all influencing how healthy we are and what we can do in our lives to be productive and happy and healthy. Healthcare is just part of it. And note that it's the system. We saw this in Hurricane Sandy. We saw it in Hurricane Harvey and Katrina. Our healthcare system also suffered, the actual infrastructure. So not only do we need the providers and we need facilities, we need to make sure the infrastructure is resilient, right? If you have a hospital full of patients who need care, hurricane doesn't care about that. It's coming whether you like it or not. We've seen evacuations of hospitals. And then does the community have the capacity to be able to repair and rebuild? So again, it's not just the quality of provision of care or the people providing the care, it's actually the infrastructure that comes with it. Just take a moment to take this in, okay? This is actually life expectancy in the United States. Dark blue, good. Dark red, not good. I don't know about you guys here or on Zoom. I don't like the fact that Indiana is not at least in the middle, right? Thinking about a Likert scale, I'd rather be neutral. I know we don't like to offer that neutral, right? We want people to commit, but I'd rather in this situation not commit to the red side, right? So we just talked about healthcare access and quality, right? But place matters. In fact, where we live in our zip code, and in this case, we're going to dive into census tract. Our zip codes are bigger descriptors or predictors, let's say, of your life expectancy than your genetics. Where you live, your zip code, or in this case, census tract, matters. Place matters more than what makes up your human condition. Okay. So let's zoom in. Indiana doesn't look too bad when we start to look at it at a smaller level. A lot of blue. You look at some of the southern rural counties, we see some red here. But of course, Indianapolis, around Indianapolis, a lot of red. We're going to zoom in a little bit closer. I believe 77.4 is our life expectancy. This is so pixelated, I can't see it up here. Okay, for Indiana, for the state, St. Joe County. Okay, interesting. Again, dark blue, good. Dark red, not so good. This is here, right here at Lang Lab. Okay, so this is the census tract, and you can actually see where the census tract is. What is that life expectancy in our community here? Yeah, 68.3. Okay. Ready for this? So you can see, let me situate you. I know it's hard in here with the screen and the projector, but we have our census tract so you can see the numbers. We're here that we just saw, okay? You can see just situated Notre Dame up here, and IU South Bend should be right in here. Here's the river. So it should be this. Here we go. Just take that in for a second. If I'm a child growing up, Angela Boulevard, 81.9. That's my average life expectancy if I grow up in that area. What is that? I haven't grown up in South Bend, but from Angela Boulevard down here, 65.7. That is a dramatic drop in life expectancy. In what, 5 miles, 10 miles, 2 miles? I feel like I should have one of you guys Google it, map it out, and see how long it is, okay? This particular census tract, if you look at the map, we have Chapin Street, we have Western, and we have Sample. So it's not that far from here. It's actually right near Kovaleski Stadium. When I was working on doing community outreach years ago, there was a community agency, Monroe Circle, that did a lot of work in that community. And I remember meeting with the guy who was in charge at that time, and he told me a mind-blowing statistic that that community is the third poorest community in the entire state of Indiana, right in our backyard. And the data show that, absolutely shows that to us. This is all available. This is public data, National Center for Health Statistics, part of the Centers for Disease Control and Prevention. Some of the other data and images that you'll see here in a second are actually from Indiana University, the Environmental Resilience Institute. Tons of amazing, cool data out there that's public health and sustainability. You can see where trees are planted, which is really neat for, understanding urban planning and development and design and all of that. Okay, so within a matter of 5 miles, 2 miles, according to Josh, dramatic decrease in life expectancy in our own community. IU South Bend here, 70.9 in our community, right around campus. The CDC measures this through what they call the Social Vulnerability Index. It's a measure of how resilient a community would be, or conversely, how vulnerable they would be in a disaster type of situation, right? And so you can see kind of that map plotted out. It looks a little bit different, but you can kind of get the shape and idea here. Blue, not good. So we're kind of reversing the color scheme here. Blue being not good, okay, higher vulnerability index. So this is, again, the address to Lang Lab, where we're at. 1 is the highest vulnerability, 0, of course, being the lowest. We're at a 0.85. This is a measure of socioeconomic status collectively, looking at household composition and disability, our language and minority status, and then access or the type of housing and access to transportation. Reliable, consistent transportation, right? So you can imagine if this area is at a 0.85, highly vulnerable, not resilient, we can only imagine what our neighboring community with the lowest life expectancy is. They also plot out for looking at vulnerability and resilience, access to healthy foods, right? We talked about nutrition in the schools and providing healthy meals, kids not being able to learn. I don't know about you guys, but I couldn't stand here if I hadn't eaten dinner. I would be totally distracted, right? So food deserts and access. And once again, we're comparing, we see the layout, the census tracts. And of course, those neighboring census tracts are similar in nature and they have similar color distribution here. And so what we're looking at is food deserts. And in food deserts, it's the access to grocery stores, the access to farmers markets, so fresh fruits and vegetables, the ability to get to those places as well. And so let's overlay. You can see convenience stores are red, grocery stores are yellow. We have our fruit and vegetable market in green. I don't know about you, but I don't really want to live down here, right? It's all scattered through convenience stores, one grocery store. The areas that are kind of gray, I guess, in the room and definitely gray online, they don't have data for this yet. Those are where we need to partner together and see if we can map this data, right? So those who are living in the most vulnerable areas also don't have the best access to food or transportation. And now on to the built environment, right? The next social determinant, the neighborhood and the built environment. Medical journals, top medical providers came together collectively and said climate change is the greatest threat to public health. That is huge. And this was worldwide, collectively coming together to say this, to make this statement that we have to understand the effects of what we're doing to our environment and the outcomes that we're seeing in health, right? We're seeing heat-related deaths on the rise. We're seeing asthma-related issues on the rise. And of course, breathing, cardiovascular, all of it comes together. Toxic stress, all of it comes together. We're seeing an increase, right? So heat-related illness, dehydration, kidney problems, cancers of the skin, all of those things causing issues, seeing that on the rise. When we look actually at the graphic, there's so much that goes into it. Healthcare system is just, again, one piece of the puzzle. It's all of us in this room that need to understand how this is coming together and how we can make change for the greater good of our communities. It is a very real thing. World Health Organization estimates between the years of 2030 and 2050, every year, an additional, so excess deaths, more than what we anticipate or normally should expect, 250,000 additional deaths per year in that 20-year time span directly due to climate change and the environment. It is a very real threat. One of the challenges that we have in particular in healthcare is being able to connect the diseases or disabilities or struggles, the health-related issues that we're seeing coming into the clinical sites, being able to connect that actually to climate change. That's an area of public health that needs more partnerships and strength, right? That's a possible partnership on our campus between sustainability studies and the College of Health Sciences, right? We need more of that. And so enough of the doom and gloom, right? How do we actually address change? There's a lot of different ways that we can do it. And the framework of public health, the public health approach is the same, right? No matter what the issue is, you always have to be able to define the problem. What are we dealing with, right? We need to be able to have the data to be able to support the definition of the problem, understand how to approach it and how to actually create evidence-based implementation or interventions, right? We need evidence and we need to evaluate the effectiveness. We need to monitor what we're actually doing. It's not throw a bunch of stuff on the wall and see if it works, right? We need to look to community agencies and partnerships and cities and counties and states across the country. What has worked for them? Can we bring it here? Okay, we've actually been watching over the past 2 years public health unfold in front of our eyes. It's science, right? What do we do as scientists? We write a hypothesis, we test our hypothesis, we see if we reject the null or right. Science is messy. We used to do leaching and bloodletting to cure disease. Why did we stop? Because we realized we were killing people and not saving them, right? Science evolved. We understood more, we learned more. Science is messy, public health is messy. There's not always one right answer because we're humans. We change and we're complex beings, right? Some of the best interventions are framed around the social ecological model. And if you look for images of the social ecological model, you're going to see a variety of images. They expand on some of them on the community, they expand on the societal. So you may see more. This is the simplest version of it. And so each one of these levels or possible interventions or influences on health. Of course, at the individual level, I can tell you, you need to exercise, you need to eat better, right? Don't smoke. Anti-smoking campaigns have actually been one of the longest standing health campaigns in our country. Very first Surgeon General's report was written on smoking. And it's been throughout time that it's been revisited the most out of the public health issues. So individual influences, right? Our attitudes, our beliefs, those are kind of hard to change, right? Changing somebody's attitude towards something, which is why we need interventions at the next level, right? Our relationships, again, part of being healthy and having health is that social well-being. We need each other. So in order to make change at a public health level, we need to engage with our family and our friends and our peers and our partners, all of those things that make us social creatures. We also need to look at our neighborhoods and our environment around us, right? How do we make change within our community? How do we actually implement interventions, health-related interventions at that community level? Gail is doing some amazing work with that, with IU South Bend and our Center for Community Engagement. And then at our societal level, these are the bigger issues. These are the harder issues. These are sometimes those hot button issues that people don't want to talk about, right? I'd rather talk about Bruno, I guess. I don't know. But no, we need to fix these issues at the societal level, right? The norms, the policies, the laws that don't support people being able to be healthy. Those have to change. So the best types of interventions, how we collectively can make change, is to do it across the continuum, starting from the individual level all the way up to the societal level, right? CEA Winslow, I told you we would revisit this again. We already talked about this part of the definition of public health. This is the other half, right? Through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. It's all of that put together. That is public health. So every single person sitting in this room and sitting online outside doing all their wonderful soaking in the sun for that vitamin D, it's all of us collectively, right? So what about you? Are you a lumper or are you a splitter? How can you here online jump in? Think about your own profession. How do you engage with public health? What part do you have to play? Thoughts? Everybody's stumped. Anybody online, how do they engage in public health? What is their profession, their field, and how do they engage? How do they fit in public health? Put Josh on the spot. Yeah, Sharon. The barbershop initiative, yes, yes. Going to the population to provide the care, right? Anybody who saw the Bender lecture, right? Dr. Thomas, who came and spoke about vaccine shots in the shop, was the initiative going into the community and providing vaccinations into the African American community. And actually, the barbers becoming community health workers as part of the process. Yes. Why not pay it forward? Yeah, you go to the community. Don't expect them to come to us. Yeah, Josh.
Oh, we have Serena says that she is studying data science and wants to, and is interested in telling the story of public health issues. Michaela is a nursing student. She's definitely interested in public health and minority needs. Anthony is interested in circumventing the pandemic at trade shows and events. Courtney is into health promotion. ML Edmond is interested in preventative education. Anna wants to be an educator to help students who come to school hungry or tired. Jenny says she's an athletic trainer, wants to talk to people about the long-term impact of their injuries. Susan is an educator at the Potawatomi Zoo. She talks to children and the elderly about the environment to help them understand how that plays into things. And for the elderly, the zoo helps give them emotional health. Very cool.
Very much so. Support, yes, support animals. There's actually an entire field of study on One Health and the connection between animals, humans, and the environment. Again, the disease that shall not be talked about. We understand that connection between animals and humans and the environment.
A couple of other folks just chimed in. Sydney is a social worker who helps people find relief in all of her cases. And Aiden is a criminal justice student who seeks to reduce community violence. And Cameron works in a daycare. And working in a daycare, working hard to find correct protocols for keeping for cleanliness, being proactive in the spread of sickness. I used to be in charge of health and safety at a daycare, so I'm right there with you, Cameron.
Yeah, sainthood for that. Absolutely. So thank you for that. And again, Winslow, essentially, you don't have to read the entire quote. I'll paraphrase it in this way. When public health is working, it's invisible. We don't see it, right? Again, back to turning my tap water on, filling my tea kettle. I trust that it's safe, right? I trust when I go to the physician or my nurse practitioner that I'm going to get the best quality care, right? Especially if they're an IU South Bend grad, right? had to give that shout out. So it's invisible when it's working. So how, at the end of this all, do we prevent a zombie apocalypse? My main takeaway for you all is that we're all public health. It's essentially the rah-rah speech, right? We're all in this together, right? We all have a part to play. Absolutely have a part to play. And we have partners all across our community who are doing amazing things. Essentially the boots on the ground, from bike lanes and advocacy and, the healthcare community providing the health, the service provision, IU South Bend, and the outreach that we do into our schools and our community. All amazing. We are all public health together. That's that. If you want to look up the data, I've got my references for you. Thank you. Yeah, absolutely.
Okay.
Q&A.
Lots of fun. So many thank yous popping up the screen here. If you folks would like, you can go ahead and just type your questions in the chat room. If you want, we don't need to worry about the Q&A module. If you have any questions for our speakers.
Except about COVID.
Still lots of thanks and lots of clappy emojis and kudos for great work.
I have a question while we're waiting for the chat.
Sure.
So I'm wondering, in this area, what would you say have been our greatest public health successes?
Honestly, there is an organization, the Health Improvement Alliance of St. Joseph County, and that was started years ago by Robin Vita at the health department. Dr. Mark Fox is part of that, but that alliance has grown. I mean, just huge. So all of what you would think of as agencies that kind of make sense. So we have our St. Joe Regional, we have, the different health agencies that are part of that, but then also other not-for-profit organizations coming in. So essentially what we've done really well in this community is capitalized on the capacity of our community and making those connections and having that information. If you want to look up, the Health Improvement Alliance of St. Joe County does have a website. You can get to it either through the health department, or you can actually just search the Health Improvement Alliance. And they're continuing their work, gathering data and partnering, again, beyond that. So our community is definitely forward thinking. We also have done a lot of work in our community with federally qualified health centers. So we have HealthLink as a resource, Indiana Health Centers. So being able to expand access to care, of course, at IU South Bend, we have HealthLink with us in our health and wellness center and the dental clinic. So recognizing that need and then having a lot of movers and shakers in our community at, from the ground level all the way up into, the CEO range of our healthcare agencies, rowing in the same direction, right? Yeah, but it takes a few strong, committed people and voices to get that going. And we've had that.
A question in the chat room was, do you think the website for finding all that life expectancy?
Yes, the Center for Health Statistics, NCHS, and I can send my references if we want to send it out, or people can contact me, quimbyk@iusb.edu. I'm happy to send that. But the National Center for Health Statistics, data visualization, it's part of the CDC. If you type in life expectancy by census tract CDC in Google, you're good to go. You'll get there. The other one is the Environmental Resilience Index, and that is through IU, actually. Big IU. Yeah, and there's a data exploration tab on there that you can drill down. It's super cool, super cool. We need to figure out how to contribute to that more in our area. So Marion County has a lot of data that's in there for sustainability types of initiatives. We definitely, because we have sustainability here on our campus, we could definitely add to that a little bit more.
In a general sense, is public health being introduced to younger audiences?
So younger audiences, I'm going to take to mean K through 12, maybe. That's a good question. I wish we had some education folks, and maybe there are some online. So Indiana state standards, yes, we have to introduce health and talk about health, right? So in the K through 12 system, of course, they're getting exposure to that, but understanding the big picture of public health, I don't know, honestly. I don't know. I think that that's a gap because I don't know that everybody understands public health. Hopefully you're taking something new away from tonight, and you can then go and explain public health and that it's all part of, our community. Higher ed, absolutely. If they're taking any of our courses at IU South Bend from any one of our faculty, we're going to talk about some of those things. So yeah.
Thank you so much, Kristen. It's been
Yep.
It's been wonderful having you tonight.
Thank you.
Everybody online for
joining us.
And thank you to everyone here at Lang Lab.
Thank you.